for the right thing to share.
I'm just going to do a little introduction.
Yeah.
There we go. My name is Amber Fast. I am Community Development Coordinator for the City of Lloydminster, and I am happy to be part of bringing Opiates Don't Discriminate to exhibit to Lloydminster. We are going to be open until 10 to 6 tomorrow and noon to 6 on Sunday. So please join us live at the Civic Center to go through the exhibit. It's been very amazing so far. And if you haven't been by, please do. I would like to introduce Petra Shultz. Petra has become an advocate for drug policy and reform aimed to reducing the harm associated with substance use. She is the founder of Mom Stop the Harm, and she has spoken at many different conferences and events, has been a huge advocate. And we're just proud to present Petra as our keynote speaker for Opioids Don't Discriminate.
Thank you so much for that introduction, Amber, and I'm very pleased to be speaking to you tonight. I was at the opening of the Opioids Don't Discriminate when it opened in Sherwood Park. And that was a very special moment. In those days, we were able to get together in person. Today, being on Zoom allows people to come from further away, which is great. But of course, it's not like being able to see each other in the same room. So I will start my presentation, and there will be time to answer questions. And I just want to encourage you to ask any question you feel like asking. I'd also like to urge you to come maybe with a bit of a different open mindset to this, as I might be presenting some things to you, some ideas and concepts that are new to you, but hopefully we'll come to a point where we can at least have a conversation and think about things differently when it comes to the drug poisoning crisis that is affecting us all greatly. So one thing, I'm a founding member of Mom Stop the Harm. We are an organization of families. We are Canada-wide. We are all families who have been affected by substance use. Most of us have lost a loved one. Some have loved ones that live in recovery or are still using. Others, and many families, you could have both. Like in my family, you can have someone. We lost our youngest son, but we also have our oldest child who is somebody with lived and living experience. So why do we share our stories? We do so to ensure that we open, in the hope that we open hearts and we open minds. So much of what happens in drug policy is driven by societal standards and by beliefs, and not necessarily by the evidence. And we have learned that by sharing our stories, people that have previously not thought about this crisis and thought it would something that would never happen to them are starting to think about it and maybe changing how they think about it. So that is my hope to bring to you today as well. And I start here, the Truth and Reconciliation meeting in Edmonton, the hearing in 2000, that was March 2014. And you might wonder why I start with this part of the story, but I have a personal connection there. I had always an interest in Indigenous peoples, their history, their culture, their place in society. And I considered myself informed about residential schools when I went to the hearing. But I was unprepared for what I faced when the survivors and intergenerational survivors were sharing the story and how residential school had impacted that, and the losses and compounding losses people had faced left me with sadness, but also with profound responsibility. Now, the hearings happened in 2014 in March. In April 2014, our youngest child, Danny, died from an accidental fentanyl overdose or drug poisoning. And after Danny died, as a parent, you can imagine how difficult it was. You lose your reason to live. You think, why should I get up today? Why should I live? Why should I breathe? Why am I here? And as I was asking these questions and not knowing how I could go on, I thought back to the TRC hearing, and I thought about, wow, I have lost. Here are people who lost children, who lost mothers, fathers, cousins. They've had so much loss in their life. They had experienced so much grief, yet they were there sharing their stories and moving on in life and trying to make a difference. And I took two personal messages away from the TRC hearing. One is that as humans, we are incredibly resilient. We can overcome great difficulty if we have the right kind of supports, but also that personal stories are profoundly transformative. And that is what I'm hoping to do with Danny's story, to transform. Danny was our youngest, as I said, and he was different from his siblings, which became evident early in his life. When he was 3, he asked for a cactus for his birthday. And when he was 12, he wanted a gold panning kit, or 10 or 12, he wanted a gold panning kit. And he thought he would find riches in the North Saskatchewan River by Devon. When he was 14, even before he got his learner's permit, he had his very own, I call it old car. He would have maybe called it a classic or a collector. And he had many of those. But Danny also struggled. He struggled with learning disabilities. He struggled as a teen when he came out as gay. At a time when this was still more challenging. Even so, in our family, we were supportive of him. And he faced some difficulties in school. And as he, in his later teen years, it became evident that he was struggling with mental health issues, with anxiety, social anxiety, especially, and depression. His siblings had as well, so I wasn't surprised. But when I approached with Danny, he just wasn't willing to talk about it or seek the help that he needed. What Danny did instead, he tried different substances to help himself with his difficulties. And later, after we discovered that he was using, I asked him once what the substances did for him. And he said, he was started out taking OxyContin. And he said, when I take one of these pills, I can walk into any room and I can just be who I am. And I thought, wow, that shouldn't be too much to ask. There should be a way to help Danny do that without him needing to turn to drugs. But as you know, getting good mental health supports in our society is challenging, and it's also highly stigmatized, especially for young men. Stigma is a huge factor, and we raise them to be tough and not to cry. And then when they should be reaching out for help, they think they can manage it themselves. Danny, as I said, started using OxyContin at a time when that was readily available. But when around about the time, he always loved to cook. Cooking was one of his passions. It's a passion of our entire family. He grew up with that. He learned how to make Oma's apple strudel when he was a little boy. And he was always in the kitchen with me. And when he decided to go to culinary school, he moved to Vancouver, and we did not know that he was using substances at the time. But that was around about the time when OxyContin was reformulated into OxyNeo, and it was not as widely available anymore. And it was in a formula that was hard to use for somebody who wasn't using it as it was intended as prescription. So Danny and so many others like him switched to heroin at the time. Danny reached out to us when he was in in his culinary program. He had thankfully completed culinary arts, was still studying restaurant management. And one day I got a call, and actually I teach at McEwen, and he called me in the middle of a class, but he had texted before and said he absolutely had to talk to me. So I apologized to my students that I had a family emergency. And Danny, without much of a hesitancy, he shared that he was addicted to heroin, and he didn't know what to do, and that he had spent his student loan and he couldn't pay the tuition for that term, and that his then boyfriend, who he thought was the love of his life at the time, asked him to move out because of his substance use. So Danny had no place to live, and he had no money, and he had to leave school. We went out to Vancouver with the help of a friend, brought Danny home, and we went through a cycle of relapse, a cycle of detox and relapse, detox and relapse. And as a family, we were not well informed about how substance use, the effect it has, how one would best support a person, the risk of relapse and the risk of overdose. These are all things we didn't understand. We thought you get the drugs out of his system, you detox, we get the old Danny back. But the reasons why he used in the first place, they were still there. So stopping to use did not stop Danny's dependence and addiction to the substances. So he would relapse again, and he would hide that from us. And eventually he went back to Vancouver again. He was, in essence, he was homeless, although not on the street. He was living with different friends and couch surfing, and had a new boyfriend. And it really escalated that at the time he started to become an injection drug user. And how people use also has an effect on how easy it is for them to later seek help and maybe find alternatives to the substance. So injection drug use really heightens the risk, not only to overdose, but also makes it harder to seek help. Yet Danny managed to go on methadone, and he found some stability. Methadone and Suboxone are medications that are used to treat opioid use disorder, and are some of the more effective ways of treating opioid use disorder. Now, Danny did not stay on methadone long enough. And part of it is that both my husband and I, again, we did not quite understand how his treatment should work. And we wanted our old Danny back, the boy that we knew. And we thought that methadone, my husband is a pharmacologist, and he correctly identified that methadone is just another opioid, which is pharmacologically correct, but it's also medication. And we didn't understand that he should have stayed on that for a good and steady until he was stable. So Danny stayed on methadone for a while, but not long enough to be stable. So he moved back home to Edmonton. He had about a year and a half where we almost had the Danny we knew before back. He worked in some of Edmonton's best restaurants. He first lived at home, then he moved into a lovely apartment in downtown Edmonton. He had some friends, but he was somewhat isolated, which was challenging for him. But he still struggled with his anxiety, and we could tell that not all was well. But we did not know that Danny had relapsed. And when Danny relapsed, by that time, because of the reformulation of Oxy and people being pushed into heroin, and heroin being in a short supply and poor quality, fentanyl emerged. One thing, and I will speak about that more later in this presentation, one thing that I have learned is that prohibition and the pressures that are caused by it gives us substances in higher and higher concentration because they're easier to smuggle, cheaper to make, there's a greater profit margin. but they also come with a much greater risk. It's harder to dose. And when Danny bought one more pill, he probably did not know what he bought at the time. And we, on a day when he was supposed to come for dinner and didn't, and we went over to his house we had a key code to get in his apartment, and we found him in his apartment. He had used, and it seems like he had very rapidly overdosed. And when we found him, it was too late. At that time, the entire family was in shock and at a loss, and didn't know. There were so many unanswered questions. And as a family, you think about your kids' grads, and you think about their weddings, and you don't think about planning your child's funeral. And when we were writing Danny's eulogy, my husband wrote the eulogy and asked our middle son, Julian, what eulogy meant. Julian studied classics. And he says, it means to speak well of someone. And so it was clear to us, when you speak well of someone, you don't tell lies. So we shared Danny's story truthfully as it was at his funeral. And it was amazing. People were surprised. There were so many people said, I had no idea. Danny looked so healthy. If you look at these three pictures, all three pictures, unbeknownst to us, were taken while he was using substances. So the images we often are shown of people using are people who struggle with other social determinants of health, people who don't have homes, people who don't have access to good nutrition, good healthcare. All this takes a toll on your body. So people were surprised, but we were surprised as well. After we were open, so many more people came out with stories and shared their stories of their loved ones. And I thought, where have these people been? Until I realized they had been hiding just as we were. Not even Danny's grandparents knew that he was using, and they were not happy with us that we hadn't been open and truthful. So being open and truthful is very important, because it also reduces stigma and it helps people reach out. After Danny died, I started to look up everything I could find about fentanyl, and I saw that there were more deaths. At the time, about 12 people were dying in Alberta every month, which seemed enormous, but pales in comparison to what we have now. And through these stories, I started to reach out to media, and through my media stories, I connected with two of my good friends, Leslie McBain and Lorna Thomas, from Mom Stop the Harm. And we formed this organization. And now we have over 3,000 members, Canada-wide, 3,000 families. And these images are some of the loved ones, members of our organization mourn. You see, most of them, they're all young, more men than women. Probably in our images, we don't have the ethnic diversity that you have with the actual victims, but that had something to do with our group and who joined when we first got together.
Petra, can I just, sorry to interrupt.
Yes.
Is there any way to maybe speak a little bit louder? We're having,
Yeah.
yeah, some people are having difficulty hearing.
Okay. Okay.
Thank
I
you.
will up my volume. See. Oh, that's not. Sorry. How is this? Is this better?
Is this better, everyone? It's clear to me, so it's hard for me to tell.
Yeah. Okay, sorry. Yeah. So these are the loved ones. And it's clear that substance use and overdose can affect anyone, and that overdose doesn't discriminate. Although some people are disproportionately affected from others, in particular, indigenous people are in Alberta, depending what year you're looking at, between Alberta and BC with the statistics, are 3 to 5 times as likely to die from drug poisoning and 5 times as likely to be hospitalized for drug poisoning. That is probably related to, again, the history of residential schools and the trauma caused by that. But that is important to remember, that Indigenous people, as well as people of color, are disproportionately affected. But really, nobody is immune, no family is immune. So a little bit of that background, where are we at in Canada? We right now are, the numbers cited prorated toward the statistics that are available, say that about 25,000 people have died since January 2015 of drug poisoning in Canada. And that to me is a staggering number if you think how little we hear about it. The majority of the deaths occur in British Columbia, in Alberta, and in Ontario, but there are increases in other regions. To me, what is painful when I look at 2016, they didn't keep stats in 2014, so Danny is not even included in this number. Most affected are young men, aged 20 to 49, and the men make up about 75% of the victims. Most people in our organization, Mom Stop the Harm, have lost sons, husbands, brothers. One would ask, why is it men that are more affected by this? And a lot of it probably has to do, again, with the way we raise men. We raise them to be tough and deal with their problems alone, but also think about women as girls and women. We always thought that strength is in numbers. Most of us don't use a washroom in a bar or restaurant when we have an opportunity to go with another woman. And a lot of women who use substances don't use alone. They either use with a boyfriend or they use with a friend. So in that sense, if you're not alone and if you overdose, your chances of somebody being there and helping you are much, much greater. Most of the overdoses are due to fentanyl and fentanyl analogs. And these statistics are from the government of Canada, and they are updated on a regular basis. Unfortunately, some provinces are slow to report, so we're always getting numbers that are further behind. This is a map that shows, again, the regions mostly affected with BC, Alberta, but also the Yukon and Ontario. Now, how did we get there? How did this happen? A big issue is, of course, is personal trauma, struggles with mental health, the stigma and discrimination against people who use drugs, and the lack of access to treatment and harm reduction services, both mental health treatment as well as treatment for substance use, and especially evidence-based treatment. We hear a lot at the moment about beds being created. But for many conditions like opioid use disorder, for example, outpatient treatment with opioid agonists like methadone or Suboxone are known to be the most effective approaches. So the answers are not in beds. And I always say that for people to reach those beds, we first have to keep them alive. And that's why harm reduction is so important. And harm reduction services are especially absent, which is important to people in the Lloydminster area. They're harder to access in rural and remote communities as they are in cities. And then there are differences in provinces. In Saskatchewan and Alberta, you can get Naloxone, the antidote that can reverse an overdose. You can get it for free. and a pharmacy. It's very widely distributed, especially in Alberta. In Manitoba, it is still not widely available. A big driving factor against the numbers that we have is the war on drugs, the toxic illegal drug supply, and especially fentanyl. And the war on drugs, if you think about it, here you see Nancy Reagan and her husband. Reagan famously declared the war on drugs. We've waged this for over 50 years. And we really, what do we have to show for? We have more people using, more people dying. We have more money being spent on the criminal justice system. We have more violence in countries where these substances originate. So one would think that if you're trying to do something in a certain way and it doesn't work, you should do it differently. What about the role of Big Pharma? I said earlier, Danny started with OxyContin. And indeed, there was a time when OxyContin was very widely overprescribed and wrongfully prescribed, for example, after a wisdom tooth extraction. Or if you had a sore neck, you walked out of the doctor's office with powerful pain meds. And of course, some of those medications made it onto the illicit market. At the moment, we don't have this problem anymore. And what I would encourage any medical practitioner is to be aware between wrongful prescribing is what we need to focus on. And overprescribing, that term can sometimes be misleading in the sense that somebody who struggles and lives with chronic pain and is well adjusted on their pain meds is probably best off staying on their meds. And by taking some of these people off their medication, again, can push people into the illicit market, which is something we have seen. Now, COVID-19 has really made things worse, and people wonder why. Part of the public health measures have meant that people were socially isolated, struggling more, but also isolated from their health services, harm reduction services, mental health services, support for addictions treatment. And then we had disrupted supply routes. We hear a lot about supply routes these days, how our Christmas presents might not arrive on time. Well, substances also did not arrive on time. So some of what is on the street now is our concoctions and mixes of substances like we have never seen before. And the toxicity rate and the death rate is going up because of that. And then also the continued criminalization of people use drugs also contributes to people hiding their use. What is more stigmatizing than using and then being criminalized for a behavior and causes people to use and potentially die alone? And then there's a lack of access to safe pharmaceutical alternatives that can help people in the situation that when somebody is using and has been using longer term, providing them a safe pharmaceutical alternatives keeps them away from the street drugs, keeps them healthy and alive, reduces social disorder, reduces crime. There are a lot of benefits, and we see it being implemented in BC, in Ontario, in parts of Atlantic Canada, not anywhere in the prairie provinces currently, except in limited format as treatment for injection use. But it's really a place we need to go. And I know for some people, it's hard to wrap your head around and saying, giving somebody who uses substances a substance. It seems counterintuitive, but if you look at the health benefits that are arrived from it, it really is something that we must consider if we want to stop the overdose rates that we see right now. Harm reduction, I spoke about, is really an important factor because Danny, a day before he died, he had asked me to make an appointment with his pharmacist and with his counselor and his physician again. And I did not have the heart to ask him if he had relapse because I knew he would probably not have been honest if he had, and he would have been upset. So I had been helping him make appointments. He had trouble making them himself. So I went ahead, I made the appointment for Danny. But Danny never was able to make it to that appointment. He died the very same day that I called his psychologist and his physician. So again, offering treatment is important. We have to make it readily available when people are at that point when they seek treatment. But first, we have to make sure they stay alive and healthy. What this includes is giving sterile supplies like needles, syringes, cookers, those kind of items. Supervised consumption site are a way of keeping people safe who are using by injection, in some models also with inhalation. Drug safety education is part of harm reduction, but what harm reduction is the most important part is a relationship. It's meeting people where they're at without shame or blame, without telling people how this is dangerous. How can you do this? Instead of saying something, okay, you can stay healthy by using a fresh needle every time. You can stay healthy by not using it alone, by having a naloxone kit handy. So if somebody and somebody with you, so if you overdose, somebody is there and can help you. That is kind of a harm reduction approach. And when we take that approach, we can build relationships that people then use when it's a time for them and when they're ready to seek help. When in 2009, we conducted a member survey to ask where the loved ones that we had lost had died. And I was startled by this response. Most people die in their own or in somebody's home, but about 20% who don't die at home, these are the places where people died. On an LRT train in Calgary, a mall washroom, a street corner, a field on the outside of town, in a staircase, back alley, parked car, a rooming house, somebody else's house, outside a consumption site when it was closed or weeks before one started operating. These are all preventable deaths, and nobody's child, nobody's loved one should die alone in a place like that. Now, your exhibit, and these photos are from the exhibit in Sherwood Park. Your exhibit is focused on young people and also helping people, which is so important. Now, people ask themselves, how do I respond to substance use? And as a parent or as a spouse, that is so difficult. It's so difficult to take that deep breath and not show judgment, not show despair, not show anger. But what you need to do is be calm, factual, and not blame or accuse. To speak to the person about concerns, maybe something you have noticed, and don't make your support conditional. There's a lot of talk about tough love, but there is no evidence that tough love works. What works is love and support. Love and support doesn't mean not setting healthy boundaries. If your child who uses is a risk to siblings, then maybe they can't live at home. But that doesn't mean that you never speak to them again. That doesn't mean that they never come to dinner. When the person discloses, and even after they seek help, the mistake we made, don't assume the person will never use again. Actually, the likelihood that they will is great. And then we have to be there and keep them safe and know how to keep them safe and respond without judgment. And I encourage all of you to learn about naloxone in particular. If you have a loved one who's using, or even a loved one who's on pain medication, get a naloxone kit and learn how to use it and have it with you. Give one to friends. Tell others that you have one and encourage other people. There's research that shows that the more widely naloxone kits are distributed in a community, in a region, the greater the likelihood that somebody's life is being saved. The other part that is probably very difficult is to take care of yourself. You can't be effective in supporting somebody else if you don't take care of yourself. And that is not easy. Like, especially as moms, we like to lay awake and worry about what has happened, what is happening, what might happen. By the time Danny died, in my mind, he had died so many times before. You always have that worry, but find ways to take care of yourself. And our organization, Mom Stop the Harm, invites any family member. Our focus is advocacy, but you don't have to be an advocate to join Mom Stop the Harm. Actually, the vast majority of people join us for support. So join. We have we are a bit of a Facebook generation. So we have private Facebook groups where you can seek support, either if you've lost a loved one or if you have a loved one using. We also have, through our Stronger Together program, we have support groups that meet in person or via Zoom. You can reach out to us I'll share our website at the end, and you'll see where you find information. One thing we can all do, and this is especially important, I don't know if we have any health professionals in the audience today, but the language we use really sends an important message. And I urge you to use person or people first language. If you look about Danny, he didn't look dirty, but if we say, are you clean? You know, the opposite of clean is dirty. So rather than talk about being clean, talk about being in recovery, or a term that is replacing recovery is wellness, seeking your wellness. And wellness and recovery can come in different forms. Don't use the word drug abuse. It's use, it's substance use. We all use substances. I'm sure all of you today had either tea or coffee or some other stimulant in like a beverage, or some might smoke some cannabis. Later, I might have a glass of wine. And some people use other substances. It's also important to note that the vast majority of people who use don't struggle with addiction. We have that problem that the answer to the overdose crisis is addressing addiction, but many people don't live with addiction. Somebody might do a line of cocaine on occasion, and that person does not need treatment, but yet that person could die from the toxic content in that cocaine. So keep that in mind. And if you hear people using language that is not person first or inappropriate, try to model different behavior, or if it's somebody you know well, maybe even speak to them. There is one exception. If a person in recovery, some people who are maybe been through a 12-step program self-identify as an addict, a person can self-identify in whichever way they feel comfortable, but that does not mean that the rest of us should do that. Now, how to approach substance use in young people. And evidence shows us that with young people as well, a harm reduction approach is the most effective way. That is what we do with alcohol. That's what we do with safe sex. I remember when I was young and sex ed was first brought into school, people feared that sex education would lead to unwanted pregnancies and to sexually transmitted disease, but the opposite is the case. We talk about alcohol. We don't tell our young people, don't ever drink. We should tell them, I hope you don't drink. It's not good for your development, for your developing brain. But if you do, and you're uncomfortable and you want me to come and pick you up, call, no questions asked. We should take the same approach for other substances. So what we should do is discourage use and set clear expectations in that regard. That is something that I wish, in retrospect, I would have done differently. But engage the young person in dialogue and model good behavior. To tell a young person that alcohol is not good for your brain and you shouldn't smoke weed and you shouldn't do other drugs, but then to really imbibe in lots of alcoholic beverages when the adults get together and young people witness it, it's not good. So as adults, we have to model the behavior we want to see. And we have to learn and understand how brain chemistry works. It's not as if illicit drugs are bad for a young person's brain. Any substance affects a young person's brain. And we have to be aware of that and not differentiate saying, oh, try a sip of beer, it's okay, but stay away from everything else. What we also have to do with young people is we have to put safety first. And just like not all young people will abstain from sex or drinking, some will use substances. And then what we want to do is provide factual information, including information about harm reduction. Young people will need to learn about the types of substances, their effects and their side effects, and their benefits and their harms. And if there were no benefits, none of us would use substances. Coffee can make us really jittery, but it also makes us more alert. Wine over dinner helps us relax and we get really chatty with our friends. But too much wine, especially if you're driving, is a really bad thing. And in cumulative effect, it's bad for our livers, and especially in women, it causes cancer. So all substances have effects and side effects. For young people, peers and social situations are huge. So think about what kind of social situation your young people are in. Because there is a point where the family home is less influential than peers. And consider if somebody uses or is at risk, consider their mental health. It is really important to consider the reasons why somebody might engage in substance use. What a harm reduction approach means, it really is on a continuum. Our first aim is abstinence, but if that is not attainable, focus on less harmful substances, or using less often, or using in a less harmful way, and never using alone. All these are on a continuum to keep the person safe or safer if the abstinence is not an attainable goal. And research has shown, there is a professor in Vancouver, Dr. Emily Jenkins. She's spoken to young people, and what young people have told her is giving them honest and factual information and showing them the risks and how they can stay safe is actually more effective than trying to scare kids, like with the DARE programs, for example, that have been proven to be very ineffective. And young people have access to the internet. So if we tell them, if we're trying to pull the wool over their eyes with what we tell them, they can find the information, and often it's maybe not the information we want to direct them to. What can communities do especially in the area of prevention? Strengthening families is something that is very important. And strengthening families is especially important for families that are at risk. Research has shown that children that are separated from their mothers are at a greater risk. They suffer something called adverse childhood experiences, which puts them at greater risk of substance use. So strengthening families, keeping families together and supporting them rather than tearing them apart with an effort to protect the child, in many cases doesn't protect the child in the long run. So we have to be more creative in the support that we provide and strengthen families to be together. Providing supports, family breakup is something that happens to many families. How do we handle it? What is best for the child? Is there counseling available, mental health support through schools, through communities? All of this is really underinvested currently across the country. Meaningful engagement for young people is important. And Iceland is really an interesting example. In the 2000s, they had huge issues with young people binge drinking and huge issues with alcoholism with young people. And they took a community effort to approach that. And one thing they did is they paid a free sports activity for every Icelandic child, and the equipment, the whole 9 yards, like your entire hockey gear, everything, fees and everything paid. Everybody got involved. And then communities got together to make rules about, where children, how they should best engage, and made agreements about not serving alcohol to underage children and such. And it's really had a big impact in Iceland. Now, Iceland is a very small country, but I always think what's ineffective in a small country should work in a small community as well. As I said, strong mental health supports, especially early intervention, are important, that we want to support people before, like Danny did, they turn to substances for help. And we need to address poverty and provide housing and secure income. Children, again, all of these situations create adverse childhood experiences that will contribute to more use for young people. Last weekend, we drove from Calgary to the BC coast, and we stopped in the little town of Merritt. And I saw at the side of a park a homeless encampment. And I had never seen that before. We see them in the cities, but even in small communities now, the city of Wetaskiwin has a homeless encampment. I think as communities, we need to do better. We need to do better for all of our citizens, and especially in light of truth and reconciliation, having our Indigenous neighbors live in encampments like this should not be acceptable to anybody. And we have to act on the recommendations of the Truth and Reconciliation Commission. They come in a handy little booklet that you can download. And they're an easy read. I encourage everybody to take a look at those. What kind of actions can community take for people who are already at risk or using? One is support local harm reduction initiatives. Sometimes we see a not in my backyard approach when it comes to harm reduction, but we all need to see it in our backyard so our loved ones are kept safe and alive. So support your local needle exchanges, support their information. I recently stopped in Red Deer and I stopped at a deli, and that deli had flyers for the organization in Red Deer that provides rural harm reduction. A lot of rural people shop there together with their bacon and German sausage. They could pick up some information about rural harm reduction, which is a great community effort. You need access to evidence-based treatment in every community. And in Alberta, we are very fortunate. We have the virtual opioid dependency program. You can go to this website and you can speak to a nurse and a physician, and you pretty much can get started on treatment for opioid use over the phone. And then they connect you with a doctor and connect you with a pharmacy. It's a brilliant program, especially for people who live further away from the big urban centers. Provide support for groups. A lot of people are familiar with Narcotics Anonymous, and these groups have been able to help many people, but they are not for everyone. A lot of people now, if somebody doesn't believe in a higher power, their approach is not behaviorally based. Some people, Danny didn't like it. He didn't like the self-blame part that he felt was part of the program. So if it works for a person, great, but there are other alternatives. One is smart recovery. I urge you to inform yourself about that. And maybe as a community, what you can do is provide free meeting space, advertise the information, have flyers at at City Hall where people can get help. What you all can do is to be open and to be kind and be generous and have an open conversation. And you can learn in this exhibit how to do this. And importantly, don't discriminate. Don't discriminate against people who use, because the end result of that can be so devastating. What we also need to do is redefine recovery. You know, like we defined recovery as having Danny drug-free, and that just didn't work for him. Here, some people that are dear to me, and they all are in recovery. In the middle, I have Guy Felicella with his family, his wife and his 3 lovely children. Guy lived on the streets of Vancouver. He used many, many years. He was an injection drug user. One day he overdosed in a supervised consumption site, thankfully. And when he came to, a nurse was sitting next to him and she was crying. And he just looked and said, "Why are you crying? Why are you crying? I'm the one in pain." And she said, "I'm crying because I thought we're going to lose you." And he took that as a moment to change. He went into treatment. He went an abstinence-based route. He had a sponsor and he had a support group, and he met his wife, and now he has a support network. So Guy says what saved his life was harm reduction, and that gave him a chance to find recovery. On the right, you have the 2 people sitting together is our co-founder, Leslie McBean, that was at a conference in Edmonton. We are in the building where Danny died. I couldn't go there for a long time, but when I finally, with the help of a trauma counselor, could overcome that, I discovered there was a cafe in the bottom, and I took Leslie there, and another good friend, Garth Mullins. Garth is a journalist who produces an amazing podcast called Crackdown Podcast. And Garth has been on methadone probably by now 18 years. Garth says whenever he goes off methadone, bad things happen. And on methadone, if you talk to Garth, what you'll find is a young man who always fires on all cylinders and who will talk circles around you no matter what discussion topic you approach. On the left, I said that in many families, there is more than one person using. So in our family on the left is our oldest, Millie. They identify as they and them. Here's Millie at their pharmacy, photo taken and used with permission, picking up their daily dose of Cadian, which is another opioid agonist treatment. Millie had been on Suboxone, had relapsed, had been on methadone long and stable. We had learned our lesson. But during COVID was finding it too difficult to cope, and their meds for their mental health conditions weren't working. And Millie kept saying, "You know what always worked?" And I know that meant the street drugs, and did not, and the thought scared me just terribly. So Millie was fortunate enough to go back on opioid agonist treatment without having to relapse. So Guy, Garth, and Millie, they're in recovery. And for each of one, the recovery looks different. And recovery looks different for many people. And we have to respect that because we want them to be well and we want them to be here. So I spoke about Mom Stop the Harm a little earlier. Here's Leslie and Lorna. Our mission is to advocate to end substance use related stigma, harms, and death. But we do provide a lot of peer support to people. In our advocacy work, this photo was recently for International Overdose Awareness Day. We rallied in Edmonton. We had a march and we rallied at the legislature. On the right is our Healing Hearts Grief Support Group. That was before COVID, of course. We all got together and we decorated cookies that we then took down to one of the harm reduction programs. What we call for in our advocacy, I said earlier, is decriminalize people who use drugs. And a recent Angus Reid survey found that the majority of Canadians actually support decriminalization. Now, decriminalization is not, it's not like cannabis. It's not actually legalization. The drugs are still illegal, but when people have for personal use, we don't criminalize them. And in this, we would like to see included as well those who share with others or traffic for their own subsistence. So there are discussions about this. The province of BC has asked for an exemption from the Controlled Substances Act to decriminalize the entire province. The city of Vancouver had already done so before the province did. The city of Toronto is currently doing so. The city of Montreal is in the process and we hope that other cities will as well. I talked about safe supply, providing pharmaceutical alternatives. So the goal here is really to manage withdrawals and cravings and to reduce harms. The goal is to reduce risks. It's not a form of treatment, but it helps people stay safe, especially during COVID when people had to self-isolate and were away from their supports. This is something we seriously need to look at and expand if we don't want to lose more people to toxic street drugs. Our families face many challenges supporting our loved ones. Stigma among the greatest, navigating a fragmented system, coping with grief and trauma, economic strain. There's a lot that families pay for. They pay for treatment, they pay for lawyers, some have to pay off dealers, and ultimately we also pay for funerals, which leads to a lot of personal, physical, and mental health problems for families. Whereas a family-centered approach, when we include families in an evidence-based, helpful way and give them the tools to support their loved ones, we can improve outcomes for all family members, but we also can include addiction treatment outcomes. I mentioned before the Stronger Together programs that we started with Mom Stop the Harm. We have Healing Hearts support groups and Holding Hope groups. Healing Hearts for those who have sadly lost a loved one, and Holding Hope are for families who have a loved one who is still currently using. You find information about these groups on our websites, and we also have online groups, again, trying to support people who live rurally or in remote communities. Ultimately, the aim is to keep our loved ones alive and make sure that they stay healthy. Because as long as the person is with us, there is hope. Here's Danny with our then puppy, who's also left us a couple of years ago, left to walk with Danny. And every day, I wish the outcome for Danny would have been different. And every day, I wish I would have known all of these things I've told you about tonight before it was too late for him, because I did not know these things. And that's why I'm now so passionate about sharing them. And I'm glad you came, and I'm glad you listened, and I hope you followed along on some of the ideas that might be new for you, and maybe think about them some more if you don't think it's the right way to go at this point. Here are our websites where you find more information: Mom Stop the Harm, Holding Hope Canada, Healing Hearts Canada. And on social media, we are on Facebook, Instagram, and on Twitter, and our handle on all these platforms is Mom Stop the Harm. Thank you again to the organizers for giving me the opportunity to speak. And as I said, I welcome any questions.
Thank you so much, Petra. That was very powerful. We will be doing some question and answers. I will stop the recording before then so people can come on to their videos if they like. I just want to mention that we have the Opioids Don't Discriminate still running from 10 to 6 tomorrow, that's Saturday, and 12 to 6 on Sunday. We have our closing ceremony with about 5 wonderful speakers from local people in recovery and from people from the Equiskeet Healing Lodge in Onion Lake. So we're excited about that. All right, and I'm just gonna pop our survey into the chat here. We have a quick survey if you guys want to fill that out. Just give us some feedback on how everything went. And for those that are watching the recording, you'll have a link to the survey underneath the video.